Welcome back. Thom Hartmann here with you. On the line with us, Dr. Dennis Deruelle. He is a physician, National Medical Director of Acute Services for IPC Healthcare. His website, Dennis Deruelle, DeruelleMD.com, DennisDeruelle.com, MD.com. Dr. Deruelle, welcome to the program.
Thank you, Tom. Good to be here.
Thanks for joining us. Do I understand correctly that you agree with Donald Trump that this shooting in Texas was a mental health problem and that it's too early for us to discuss the role of guns in our society?
Well, no, I wouldn't. I think it's always appropriate to discuss the role of guns and restriction of guns. However, I do agree that this was a mental health issue. This individual, again, reported through people that knew him, was on medication for mental health from 6th grade to 9th grade, referred to as over-medicated. And I think looking at his history, again, I have not examined him. I have not looked at his records. But looking at his history, he was showing signs of mental health issues all the way along his life. And therefore, the idea that we need,
So what?
Well, I think, again,
there are mentally ill people all over the world, Dennis. There are literally, from today's New York Times, if mental health made the difference, the data would show that Americans have more mental health problems than do people in other countries with fewer mass shootings. But the mental health care spending rate in the United States, the number of mental health professionals per capita, and the rate of severe mental disorders are all in line in the United States with those of all other wealthy countries. We are no different than the rest of the world in that regard.
Well,
however, the major difference between us and the rest of the world is that with 4.4% of the world's population, we have 44% of the world's guns.
Right, but okay, so let's just
it's like what you're saying. You're laying out a mitigating factor, right? Mental illness. Let's say the mitigating factor was drunkenness. Right? If gun shops and bars, if all bars had to have a gun shop in them, do you think we might start having a lot of shootouts in bars? I think so, because people are temporarily mentally disabled by being drunk. It's got nothing to do with the gun problem, though, or the killing problem.
No, it does, because look at the mass shooters. I mean, they have had red flags, and that's what we have to put. We have to identify them. Many of them have had domestic violence, and this one did too. And when you pair mental health with domestic violence, that's a red flag. And physicians... That's
a red flag for a lot of things, Dennis. That's a red flag for child abuse, for spouse abuse, for being dysfunctional in society. This is not why people are killing people.
Nobody's assessing. No. Nobody's assessing this. What is their risk of hurting someone
I don't understand, Dennis, why as a physician you're carrying water for the National Rifle Association, a trade association for an industry that manufactures products that only kill people, which is the opposite of your Hippocratic Oath.
No. I'm talking about
mitigating. You're shilling for the NRA here, Dennis.
No.
I don't get it.
I'm not. It has nothing to do with the NRA. We need to connect these databases. Okay, this individual fell through. This is a gun control issue. I'm for, quote unquote, limiting guns for people like him. I think that's very important. But here's the point. We need to assess when someone's been in the system, that we know they have mental health issues, we know they have domestic violence issues, and we can't connect the dots to keep a gun out of their hand and we have an issue. That's what I'm saying. I mean, you can characterize that as
in that case, then what are you suggesting? Hooking up the database? I mean, it's so imperfect.
Yeah.
If he had chosen to buy that gun at a Texas gun show, which doesn't have to check the database, he'd still have the same damn guns.
I got it, but that doesn't mean we don't start limiting it where we can. And the fact is that
why not limit it everywhere?
We have to start.
Why not, Dennis?
Somewhere.
Why not simply say, when cars came along in the 1880s, 1890s, and they became a big thing in the 19aughts and 19-teens, and somewhere between 1905 and 1915, we started putting into place rules about car ownership because cars were starting to kill people. They were going fast enough and they had enough mass, they were damaging people's bodies. And so we said you've got to register the car when it's manufactured and you've got to maintain a constant chain of custody until it's destroyed, number one. Number two, you have to demonstrate your ability to drive this car safely. You have a driver's test, both written and do the work. And number three, you have to have liability insurance, which is a marketplace intervention. So when people regularly get in car accidents or when people regularly get busted for drunk driving, their car insurance rates go from a few $100s a year to thousands, tens of thousands, or even impossible to get. So the marketplace restricts their access. These are common sense, rational things that don't impinge anybody's so-called right. Right? You've got a right to drive a car, you've got a right to own a gun, but you've got a right to assemble together and petition your government for redress of grievance. But you can't exercise that right without a permit from the police department. I mean, so why not just do something very straightforward that just takes on this issue of all these guns? 44% of the world's guns in the hands of 5% of the world's population? That's a prescription for disaster.
Well, that may be true, but I'm zeroing in on mass shootings and things like this. And if you look at those people and the individuals, they fall into pretty much a small group. They do have red flags. We need to connect the databases on those. And I think that would be the best way to start to begin to mitigate that. You're addressing a bigger issue and a bigger problem, and I'm specifically focusing on this issue.
I think we need to address this bigger issue. We've got a mass shooting every week in the United States. If you define a mass shooting as more than 4 people being killed, literally every week. And we've got, but beyond that, we've got 30,000 Americans. As an American,
and see what they have.
Yeah, I mean this is
we need to address that.
This is, again, this from today's New York Times. In America, crime is simply more lethal. A New Yorker is just as likely to be robbed. We're not talking mass shootings here. We're talking gun violence. A New Yorker is just as likely to be robbed as a Londoner. In other words, the rates of robbery in London and New York City are identical. But a New Yorker is 54 times more likely to be killed in the process. That's a 5,400% increase in the probability that you will die simply because there's more guns available in the United States than there are in the United Kingdom. That is the core issue, is it not?
Well, that's a different issue, and I think that is a problem.
Well, maybe we're talking about, maybe I misunderstood our discussion. I thought we were talking about, gun deaths in the United States and what to do about it. You want to exclusively talk about mental health?
About mass shootings, but, in general, I'm in favor of rules that keep the automatic weapons, I would limit them, so I'm going to be upfront. I agree with that. Anything that limits access to that in general, I think is an okay thing to do. And I think we do have too many guns. But I don't think the answer is necessarily doing away with the Second Amendment. I think there are a lot of other things we can do in the meantime. But to me, mitigating these mass shootings has a lot to do with the red flags and picking it up and connecting the dots in our system. That's really where I'm focused.
In a 14-year period from 2000 to 2014, Switzerland had 1 mass shooting. They have the most guns per person of any country in Europe. They also had the second most mass shootings. Finland has the second most guns in Europe. They had 2 mass shootings during that 14-year period. To the best of my knowledge, no other European country had any. We had 133. The only thing, the difference in mental health rates between Switzerland, Finland, and the United States is unmeasurable. They're essentially the same. We have roughly identical rates of the percentage of people who work in the mental health field, the percentage of people who are diagnosed in the mental health field, the percentage of people who are imprisoned as a result of acting out, mental problems. I'm hitting a break here. I'm sorry. Anyhow, Dr. Dennis Deruelle, it's been interesting talking with you. You can, his website, DennisDeruelleMD.com, and you can tweet him at Dr. Deruelle, DRDERUELLE. Dr. Deruelle, thank you for dropping by.
Thank you, Tom. Appreciate it.
Good talking with you. We'll be back.